Well, I was fortunate enough to do the rural health tract. I did it for my pediatrics clerkship at the very first block, so August of last year, and then did it again for family medicine in January and February of this year, which is like the fourth block after Christmas. I volunteered to do it when they had first mentioned it. Dr. Bell and Dr. Toussaint did. I knew it was from the same area that I'm from, so I said, heck, sure, I'll sign up and do it. So I volunteered to do it to kind of agree to test pilot it for him and work out any kinks if that was possible, because I was kind of familiar with it. And I found it to be a very rewarding experience.
Yeah.
During my pediatrics clerkship, I was mostly at an outpatient clinic, and I was working with two pediatricians, Dr. De La Rosa and Dr. Aganan. And they were kind of spread among 3 different offices, but they kind of went out of their way to give me some nursery time as well. So I got to spend a couple of days of the week doing hospital work as well, following them on rounds, seeing patients, after C-sections, and following them through the nursery, and then again as outpatients a couple of weeks later. And then during my family medicine, that was almost exclusively outpatient on an outpatient basis. That was at Dr. Gill's office and Dr. Josie and McNaughton. So spread among their 2 offices. Well, having been from there, the thought is always in the back of my mind, well, maybe someday I'll come back and work here. So I think for me that was a nice kind of test pilot to see whether or not I would actually enjoy working as a physician in a rural community where I grew up. And I think I kind of affirmed that as I did it. When we're here in Dayton, we see a lot of different patient populations as far as the hospitals that we work at. So I think this was another experience for me to see a different patient population. It's similar to some here, but it's also very different from some here. So it was a great learning experience to kind of compare and contrast those. I think for me what stood out the most was the extra lengths that the doctors went to try to make it as great of an experience for me as possible. When I mentioned previously about spending some time in the operating room during a C-section, then following those kids to the nursery afterwards, and then seeing them as a pediatrician later on. I think that's a very unique experience. Having talked to my classmates here, none of them really had any nursery time. So I think that kind of gave me a leg up, if nothing else, just as experienced and, kind of just knowing what goes on in the hospital from that sort of angle. During my family medicine rotation, we had a patient, and Dr. Josie went up to me beforehand and he said, hey, I've had this patient for a very long time. She's got a lot of comorbid conditions. She's on a lot of medications, and I just can't seem to break through. I can't get her to, just be compliant, for lack of a better word. And so he said, why don't you take as much time as you need this morning, spend it in here, try to get to the root of what's stopping her from doing all these things. So I got to spend, in a family medicine clinic, I spent 4 times as much time as I would normally spend with the patient. And after making her cry, I think I got through to her a little bit. It was unintentional, but it was a very good learning experience, kind of seeing the psychology behind how people are the way they are, and then contrasting that with the actual medicine that we're trying to do. But I think that was a very rewarding experience that really sticks out in my mind. Well, having grown up in a rural area, most of my exposure was to my family doctor, who's kind of my mentor growing up. So I had always kind of felt maybe I would want to do family medicine. Having gone through it, I don't think that's the correct career choice for me, so that kind of reaffirmed to me that the choice that I actually do want to do. But I think it also kind of did give me the reassurance that I would really enjoy going back and working in a rural community like that again. I think one of the biggest benefits to doing this experience for them is that they honestly won't have to share the experience with any other medical students, and that kind of sounds worse than I mean it to. But whenever you're working with a lot of other medical students, there's only so much food at the table, so to speak. So whenever you have to share those patients with residents and other medical students, your experience to actually do things with the patients, see the patients by yourselves, and then have to report back, that's kind of limited as far as that goes. Whereas going up north, I was able to work with multiple attendings, work directly with them, learn directly from them, and see patients on my own, and actually do a lot of the minor procedures that we got to do, rather than having to share that with people. And again, it was a very different patient population, so that was also a great learning experience.